get into the rest of the skeletal system. We left off yesterday with the vertebrae, and you see there are no questions in there, not a whole lot to write down. But when we talked about those three abnormal curves of the spinal column, excuse me. We also discussed all the discs and problems that people can have with the discs between their vertebrae, slip disc, bulging disc, thinning discs, and so on. There is one more thing I want to mention here about the vertebrae, and that is when we look at their shapes with the bony part, the three processes, and then the spinal canal, or for the spinal cord back there. In some cases, some babies will have a condition where, especially at the lower back, the large vertebrae of the back, of the lower back, this process doesn't form, and it leaves a gap in their vertebrae, like that. Now, the spinal cord passing down through here has no protection right there. And also the membranes that surround our spinal cord, called the meninges, they tend to stick out at space. And they bubble out like that. The spinal cord is still tucked in there, but this is all fluid filled up in this bubble. And that state is called spina bifida. Okay. And let's find an image of that, because they're pretty dramatic when you see them. If you walked in and saw your baby with one of these, it would scare the shit out of you if you didn't know what it was. One of those. Okay. And you're like, what the hell is that? It's a spina bifida. We need to go in and repair that. Okay. And they will go into the spinal column. Okay. First we need to drain all this excess fluid. And remember, this is the same fluid that's circulating around the baby's brain. So as a result, the chance of causing infection in the brain can be pretty high if you don't do this procedure absolutely sterile and correctly. Okay. But take out the excess fluid, remove the excess tissue, and here's kind of an illustration of how it does stick out like that. And sometimes bring the spinal column with it, which can be an issue. This can lead to paralysis, permanent paresthesia, or numbness and tingling in the extremities, and so on. So drain the fluid, remove the excess tissue right there, and then use a filament called bone glue that actually builds a vertebral process for them. But the damage is typically done by then, and the baby can have some paralysis. There's another one with the spinal cord sticking through with it. Yeah. But that doesn't always happen. And if the spinal cord doesn't stick through like that, there's a good chance they won't have any type of issues with their sensation or movement. If it does stick through, then there's a danger spot right there where it gets squished as it pokes out through there. And again, that can lead to some permanent paresthesia. The numbness and tingling feels like your foot's just falling asleep. That's paresthesia. And then up to and including paralysis. So spina bifida can be quite dramatic or severe, and again, the doctor's handling that appropriately. Okay, so that's spina bifida, when the meninges stick out through like that, and sometimes pulling the spinal cord with it. All right. So we've discussed most of what we need, or everything we need to talk about with the, well, actually one more, right down here, the coccyx. Again, bring the picture up a little bit bigger so we can see this. The coccyx is right down here, a little tip right there. And it is 4 bones fused into one. And what it does is your rectum passes right along here and then out the body. So the coccyx helps to support the rectum right there. Is what people often refer to as the tailbone. And again, when people hear something and rather than look it up, they just assume they know what they're talking about. And they put out stories like, this is the bone that your tail used to be attached to. And that's why they call it the tailbone. That's not why they call it that. It's called the tailbone because it's at the tail end of the spinal column. Okay. If humans did have tails, it was millions of years ago. It wasn't anything that you would be able to see in our skeleton today. Because remember, if you don't use it for something, you lose it. So the tailbone supports the rectum back there rather than a tail of any type. However, if somebody falls just right, they can break their tailbone. Now imagine what that must feel like. Places like, not real popular today, but back in the day, y'all, roller skating is what everybody did. Friday, Saturday nights, Tuesday nights, everybody was at the roller rink. And it was a pretty dangerous place, man. Shootings up in there, that type of stuff. Whenever we roller skated, when we would tie up our skates, you would only tie them to the curve of the foot right there. You wouldn't go up, you know, the big boot part that comes up, you never tied that part, that stayed open. And then you would tie it up right up to, and let me rephrase that, you wouldn't tie them. The ties would be permanently put in position. You just slip your skates on. And you always left the upper part open. Anybody know why that's so important? Why we kept the upper parts of the skates open?
Where ankles that move.
Say what?
Where ankles.
Okay. Good guess.
So you can
Slip them off when you had to run.
Yeah, so you can get them off your damn feet. Yeah. Yeah. You didn't want those things, you're fighting with wheels on your feet. Okay, that was kind of dumb. So actually what you could do is you raise your foot and you grab the back wheels and you pull them straight off, and now you got a weapon. So yeah, we did not. And as a result, we always had blisters on our feet from moving back and forth inside the roller skates. But the skating rink was a pretty dangerous place. My first girlfriend was killed in the skating rink. She was shot and killed in there. Not when we were going together. It was later on when we'd grown up a little bit. And I went back from the military to visit, and turned out that she'd been killed at the skating rink. So it was a pretty dangerous place to be. However, we went every Saturday night. You couldn't keep us away from that skating rink, man. But anyway, also living in places like Missouri, Chicago, North and South Dakota, Nebraska, where it snows real good, Colorado. And buddy, see, y'all folks that are from the South down here, y'all just don't understand what snow is. Okay. You see people on TV throwing snowballs, you know, like in the winter wonderland, and somebody throws a snowball and poof. So they throw one back, poof. Y'all, we would be challenged to a snowball fight the next morning by another group of kids from the block over or whatever. And we're like, all right, we'll meet us at the lot. The lot is any place where the house has been torn down. There's just empty lot there right now. Meet us at the lot, okay? And we would go out the night before, and we would make our ammunition, make our snowballs, and stack them up and get them ready to go. So when you come out in the morning, those things are hard as rocks. Getting hit with a snowball was no joke. You might as well have been throwing bricks. And if that thing hits you in the head and some of that ice gets in your ear, you're done, man. And as you know, we value toughness, you know, And if somebody quit in the middle of the snowball fight and they go, I'm going home, well, you punk. And then all they have to do is turn around and say, I got hit in the ear. All right, go ahead, man. Everybody, you get hit in the ear with one of the stupid things, you're going home. That's all there is to it. But watching people walk in that damn snow, y'all see them on TV as well, shoveling snow. Well, when you get all that shoveled out the way, there's that layer of ice underneath there that you now need to. My dad was too cheap to go out and buy salt, so he give you the spade shovel. Boy, go out there and break that ice up. Yeah, man, that should be like this thick. And you're like with that spade, clack, 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 cracking up that freaking ice. But if you're walking along, man, and you hit a good ice patch, you're done. And it's fun to just, our house, when we moved out of the project, we moved into this little house, and our house was right on the street going to a main bus stop up there. So there was a main street at the end, and the bus stop was right at the end of our street. So we had a lot of traffic walking up and down in front of our house. And you could just sit there in the window and just watch grown folks just falling in that damn ice. And it's funny to watch grown people fall. Just hit a spot and boom, right on their ass. And sometimes you had to call an ambulance for them because they break their tailbone. All right. So anyway, that is the coccyx. It's called the tailbone, not because of where the tail was attached, but because it's at the tail end of the spinal column, our tailbone. All right. So let's go on and do the rib cage now. You see here, ribs are known as costals. And let's do each one of those. The ribs are separated into categories, and we'll follow the first 7. 1, 2, 3, 4, 5, 6, 7. And you see all 7 of those come around and attach to the sternum. So since these are all attached directly to the sternum, they're called true ribs. Each one comes all the way around and attaches right there to the sternum. And that makes them true ribs. Now the next 3, 8, 9, and 10, they come around to the front, but they don't attach to the sternum. They attach into the bottom of number 7. And that makes those 3, 2, 3 false ribs. And the last 2, 11 and 12, they don't attach in the front at all. They stop short of coming around to the front. So they're called floating ribs. So that's where we get those names from. The first 7 attaching directly to the sternum, 8, 9, and 10 attaching to the bottom of number 7 right there. And 11 and 12 don't attach in the front at all. True ribs, false ribs, floating ribs. Now, the good thing about a rib is that if you break, for example, this rib right here, the ribs are being held in with tension. So if you break this rib, it swings out that way rather than swinging in and poking organs in there. Although that can happen if they get pushed in. For example, somebody takes a stick and boom, hits you in the rib and pushes that rib inward. It can lacerate organs inside. But in a natural situation, playing football or whatever, you break a rib, rather than going inward, that rib springs out like this. And you can feel that bad. Oh, man. And you run, as paramedic, you show up, you run that out, broken rib right there. You can feel it sticking out like that. And we'll just take you into the hospital. The doctor will literally push the rib back in place, get everything aligned. And usually we just need to put some tight tape right there. And then we teach you how to tape it for 3 or 4 weeks until it grows back. The ribs heal faster than any other bones in the body. Ribs usually only take about 3 to 4 weeks to heal back in place, as long as they are realigned. All right. And the last thing we want to talk about then is right here, known as your breastbone. And the actual name of it is the sternum. Now, the sternum does have parts on this image. I don't know if you can see it real well, but there are lines that separate the three parts of the sternum. The upper part right there is the manubrium. The middle part is the body. And we already mentioned the tip down there, the xiphoid process. So there are parts to the sternum. You see that I don't test on those, but I do want you to know that the breastbone is known as the sternum. And it's three parts, the manubrium, the body, and the xiphoid process. All right, so from this slide, take away those two ribs. Ribs are also known as costals, as in the phrase intercostal. Does anybody know what that means? You remember your prefixes? What does inter mean?
Enter the ribs.
Inside, like
Inside, that's intra. Inter
Hitting
is
the ribs.
like internal.
Within.
Like just with the
Yeah, I got it. Woo!
yes, intercostal is between the ribs, as in your intercostal muscles, the muscles that help us breathe. That's what you're eating when you eat ribs of whatever animal. You're eating the intercostal muscles of that animal. It sounds kind of creepy when you actually say it like that, you know. Oh, you're eating ribs. Yeah, you're biting on an animal's rib bones, pulling the meat off of them.
It tastes good.
Y'all are just horrible people, man. Anyway, so the intercostal muscles. Also, you see terms like subcostal, below the ribs, or substernal, below the sternum. Heart attack pain is often described as being substernal, below the sternum. All right, so the costals and then the sternum, our breastbone. One of the reasons that I have a pinched nerve is because of the sternum. You see that these ribs come all the way around and attach to the vertebrae at the back. So what happens if you cut the sternum in half like this, and you pull each half out like that in each direction? These ribs are going to be moved, and it changes their position back here as well. And the nerve that was coming out my back, as they moved that nerve got pinched off by a rib that was moved when they did this procedure on me. All right. So that is how sometimes we end up with pinched nerves back there. You start shifting any of these vertebrae or any of these ribs or the sternum or anything like that, it's going to change their position on the backside as well. And that can lead to that radiculopathy or pinched nerves back there. So get those two ribs, the ribs and then the sternum. All right. Now our hip bones. Is that a drawing right? Okay. Yeah. Our hip bones. Go ahead and get that. The ilium is the hip bone. And you see it right there, outlined right here. The ilium. This is the baby seat in women. Well, actually, no, that's not the baby seat. I'll show you the baby seat here in a little bit. Y'all know what I'm talking about? Oh, the baby seat right there on the side. Yeah. Men don't have that. I'm trying to hold my son. And he just like, boy, get up here. But mom, he could get up on mama like, oh, yeah, I'm good. You know, got to get on me. He's just sliding down my boy. If you don't stop, why can't I hold him on the side like a woman does? Because I don't have the built-in baby seat right there. All right, so anyway, that's the ilium, typically where you would wear your belt if you are like dressing yourself right. but we know some people wear their belts way down here. That's ridiculous, y'all. I saw a kid, and don't get me wrong, we had our fads when we were young too, the way we wore our clothes and so on. So I don't fault them because, it's kids, okay, young people. But when I see like older, people in their 30s and 40s walking around with their damn pants hanging down around their ass like that, really, dude. I saw a kid, y'all. This kid was playing basketball, and his basketball shorts were down so far his entire ass was sticking out. And he's bouncing the ball, holding on to his pants like this, playing basketball. Really? The hell? Just pull your damn pants up, wingnut. So anyway. So the ilium is up around where we wear our belt. And the ilium has certain parts to it, and you see them listed there. The upper bladed part is the part we call the ilium, but the actual edge right there is known as the iliac crest. We use that as a landmark when giving injections sometimes, the iliac crest. Locate the iliac crest and then move 2 fingers or 4 fingers or whatever down from that ridge. All right, so that's the ilium. And the part that you're sitting on right now is called the ischium. We've already mentioned the pubis symphysis right there. And there's your sacrum and coccyx. But this right here is a dip in the bone. And that forms the socket for the ball and socket joint of our hip joint. And that's actually called the acetabulum, where the femur bone actually fits in there. The ball of the femur goes right in there. And we rotate around within that socket. So that is the ilium, the ischium, and the acetabulum. From here, I need you to know that the ilium is the hip bone, because there are other, we use all types of landmarks on the skeleton to let us know where to do something. For example, right up here in the shoulder, you find this bone right there at the tip of their shoulder, and then you place your hand on it, right on that bone like this, with the arm out this way. Put your hand right on that bone, roll your hand over, squeeze up, and that's where you give your shots. So we use the skeleton to identify procedures that we do on the body quite often. And the iliac crest is something that you should be able to locate on somebody. And that's your ilium. Now, sometimes, remember what I said about yesterday about when 2 bones come together at a joint, we name that joint after the 2 bones. So this bone right here is your sacrum. This is your ilium. So this joint right here, where those 2 join, is called the sacroiliac. A connection or a joint between the sacrum and the ilium. And when you break your pelvis, that's what they're talking about. You break the sacroiliac right there. And this bone is literally free floating in there a little bit and moving around. And imagine what that must feel like. So being hit by a car, falling off something, a good little distance, you can actually break your sacroiliac falling off an exam table. I've heard of that before. It wasn't one of my clients, but it was in a hospital where I was working. And we had all to go to safety training and because a patient fell off the exam table and broke their sacroiliac or their pelvis. Okay, so that is another illustration or another example of 2 bones coming together and then naming that joint right there. If you do break your sacroiliac, they're going to put surgical pins in and pin that thing back in place. Now, we use different names. A surgical pin is actually a screw. The rest of the world out there call them screws. We call them surgical pins. And they're literally going to screw your pelvis back on. Okay. So that's how we repair that. The good news is that when we started doing this procedure, it stopped or got rid of the body cast. Before this, people were put in a body cast, y'all. I mean, literally from the mid navel, from about the belly button down to the mid thigh, and just plastered all the way around with a rectal tube and a catheter, a urinary catheter. And they were in that thing for about 5 to 6 weeks in a freaking body cast. So today they bring you in, 1-day surgery, pin it back in place, give it a couple of days to heal in the hospital, make sure you're pooping, and then go on and send you home. So that is your ilium, our hip bones. And this is an artificial hip put in place. Now, the upper leg bone is called the femur. And I wish I'd have had a better picture of that before I went to the replacement. The femur is our thigh bone, and it's the largest bone in the body. Go ahead and get those two reds. The femur is the thigh bone, and it's the largest bone we have. So if you're in a ancient cave somewhere and somebody attacks you and the only thing you can find is human bones, look for the femur bone and then beat their ass with that. That's a pretty big bone, solid bone too. All right, so what does the femur look like? We start with the ball of the femur, and then a part known as the neck. Remember, the acetabulum of the hip is right there. The ball slips right in there. The neck of the femur, and then the ball of the femur. And then there's a part that raises up a little bit, comes out, back down, squeezes around, boom. And there's one on the inside as well, not as big, but boom. And that's your femur bone. And this part right here, that's the baby seat. And men's femurs don't stick out as far as women's. Okay? So your femurs stick out, and that's what causes hips for the baby to kind of rest on up there. And no, that's not going to make your baby bow-legged. I know you've heard that before. Well, it's going to make the baby bow-legged. No, it's not. Okay? But anyway, that is the ball, the neck. Out here, this big part right there is the greater trochanter. And the part that sticks out on the medial side of the bone is the lesser trochanter. That's another landmark that we use. When we give a shot called ventrogluteal, you place the palm of your hand right on the greater trochanter at the hip. So you squat down, put your hand on the greater trochanter, spread your fingers, and give your shot right there, right between these two fingers. So finding, again, the shot area based on the person's skeleton. So hand on the greater trochanter, which is easier to find in women than men. Boom, right there, and boom, give your shot right there. So that is the femur bone. Now, before we go any further on this, I do want to go back to the pelvis to talk about something I didn't talk about earlier. And that is this right here is a male pelvis. How do we know that? There's this spot right here called the pubic arch. Since the female pelvis is wider, the pelvic arch will be flatter. So this is female, that's male. And with it being wider like that, the femurs get pushed out further. So the trochanters are out here, where you can actually see them and feel them on a woman. But in men, the trochanters are in further. So you don't, they're not as obvious. Now, because of that too, when you look at the female figure, if you will, you might see that their legs actually, let's do the female pelvis. The legs actually stick in with the knees kind of coming towards each other a little bit. In men, the legs tend to come straight down. Now, as a result of that, we tend to see more knock-kneed women than men. You know what I'm talking about? Knees hit together in the middle. Okay, them childbearing hips right there, y'all. And also, this pushing out of the bone like that can cause the feet to rotate in towards each other. So we see more pigeon-toed men or female than men. Okay, and that's somebody you're talking about with childbearing hips right there, y'all. The knees are coming close together and the feet are angled in towards each other like that. Oh yeah, that's childbearing hips right there. That's kind of attractive to me. I was like, oh,
I don't like it.
look at hips on that girl, huh? What?
I said I don't like it.
You don't, poor thing. You know, people make fun of you, don't they? Oh, you pigeon toe. Yeah,
Yes.
it's kind of sexy actually because it's just boom. Look at them childbearing hips on that child, man. Boom, and feet turned in like that. So anyway, that's why we see more knock-kneed women and pigeon-toed women than men, although it does happen in men occasionally. All right, so that is the pelvis and the pubic arch and how we can tell the difference between a male and a female skeleton by looking at the pelvis. So when we're trying to find out who it was that died, if we're just finding a skeleton out there and we're trying to find out who this was, we're going to be looking for some specific bones. And one of them is the pelvis to determine whether they were male or female. All right, now, of course, today, you can get DNA out the bone and that type of stuff, but initially, find that pelvic bone, and you'll find out. And if we're trying to find out whether you're an adult or a child, we want to find the femur bone. And the femur is the best indicator of growth in somebody to determine a person's age. All right, now back to the femur bone with the ball, the neck, the trochanters. Right. When somebody breaks their hip, it's kind of a misnomer because when you say hip, you think of the ilium. But what we call hip is when you break your hip, you were breaking your femur bone. The acetabulum and the ilium are up here. Right. So when you're breaking this bone, you're breaking usually right there at the neck of the femur. That's the most common hip fracture. As you can see, that's the weakest part of the bone. So that's the bone that's usually going to break. However, sometimes some people will have intertrochanter fractures, a fracture that happens between the two trochanters at the thickest part of the bone. That's usually going to happen when the person has some type of bone disease like osteoporosis or something like that. Paget's disease is also called brittle bone disease. Their bones break real easily. So if you have some type of disease, you're more likely to break in the widest spot right there. But most hip fractures are going to carry at the neck, a femoral neck fracture. And what we're going to do for that is take the ball off completely. And then we're going to drill down into the femur bone and make a long shaft down in there. And yeah, this does go down pretty far. And then the prosthesis is inserted into that shaft. It's usually stainless steel or titanium. It goes all the way down in like that, and then the neck comes out, and you have a stainless steel or titanium ball right there. So all of that red is metal. So you put an awful lot of metal into a person's hip when you give them one of these things. And we had an X-ray on the PowerPoint. Yeah. There is your artificial hip. Now, that's either stainless steel or titanium, but it's an awful lot of metal in there, y'all. And it is getting, close to the surface. So this tends to get cold when it gets cold outside. This is what they're going to start talking about doing to me soon. With my DJD and the constant pain in my left hip, We had to cut our flea market trip short the other day because my left hip was just, it was bad, y'all. So they're going to start talking about doing this soon. Again, I'm going to put it off as long as I possibly can because who wants this much metal sticking in their body? Already got enough.
Mr. Mahone,
Right.
my brother, we were talking about jobs and running and all that stuff that damages your body. He was a firefighter and he did all those firefighter competitions and stuff. He had 2 of those hip replacements with titanium at 36.
Yep.
And he lived in Alaska at the time, so
Now to move to Florida, man.
so but he says that he's never felt better now. So you might want to think about it. I mean, he's like, it feels amazing.
Mm-hmm.
So he's never.
That's also, if you ever wondered why so many old people move to Florida.
Hmm.
Yeah.
Yeah, he said it ached and hurt a lot because it would get cold because it was titanium.
Mm-hmm.
So he said it hurt a lot when he was in Alaska, but when he moved back, he was fine.
Right. Yeah.
Phew, both of them.
Yeah. So you better be looking at San Antonio, Florida, Arizona, California. Get your butt out of Colorado,
Yes.
Chicago, New York. You're going to be in some pain up there, y'all. So now you know why so many old people move to Florida, because of the weather. And why so many, not why, but so many people with respiratory issues, COPD, emphysema, they move to what state? What state do you move to if you have breathing issues like COPD?
The cold states.
Colorado.
Yes.
Colorado.
Oh, sorry, my was.
Dry air. Okay.
Yeah.
If you have these conditions, you do not want to live in a humid place. You move to a place where the air is dry. Arizona, Colorado. All right, so those are what hip replacements look like. From here, take away the femur, is the thigh bone, and it's also the largest bone in the body or in our skeleton. Okay, welcome, Maria. I see you. I do have, or where's Tatiana? Tatiana here yet? I didn't mean Maria, I mean Tatiana. Okay, all right. Anyway, so those are the 2 things you need to know about the femur bone. The next bone we're going to talk about is the kneecap, known as the patella. Now, the kneecap is free floating. What that means is that it doesn't form a joint with any other bones. You have your patella, and then cartilage that attaches it up here and down there. As a result, the kneecap can be moved side to side like that because it's only attached at the top and bottom. So if you relax your leg, yeah, you can reach down there and you can move your kneecap side to side. We probably didn't have this bone initially. This is a bone that I believe evolved into our skeleton. It's not part of any other, it doesn't attach to any other bones. Why did it evolve? Well, when we stood upright, so that we can see better, that also required us to do something else now. What were we required to do once we were able to stand up now and look around? And we can see over the tall grass and that type of stuff. Now that requires us to do something else.
Rotation.
I guess.
Mm-hmm.
If there's something on the ground, guess what we have to do now? We have to bend down to pick it up. And bending and putting pressure on the knee or that joint right there. What happens when you don't wear shoes and you walk around outside barefoot a lot? What happens to your feet?
They get white, flat foot.
They get calloused. They get hard underneath. I think the same thing happened here. Other animals don't have kneecaps. Animals that walk on all 4. They have the joint, but they don't have a cap over that joint. That cap didn't evolve until we started kneeling on that joint. It was all cartilage right here. And as we kneeled on that, it got harder and harder and harder. And eventually, over thousands of years, a bone developed in there. So it is a free floating bone only attached at the top and bottom. When we do surgery on somebody's knee, they're going to cut this ligament right here and swing the knee joint, the whole structure down out the way. Do the procedure and then pull it back up and suture it back together. So the patella is our kneecap, and it's a free floating bone. And yes, people have broken their kneecaps. That was common with the gangsters, to kneecap somebody with baseball bats or lead pipes or the big plumber's wrenches and that type of stuff. But, you know, falling down, being hit by a car, falling off a bicycle, those type of things can cause patella fractures in people. If you fracture the patella, they're probably going to go on and take it out and replace it with a plastic disc. It's hard plastic, but a hard plastic disc in there. So that's your kneecap, also called, the actual name is the patella. At the lower leg, we have two bones down there, and we define them as the large bone or anterior bone of the lower leg is called your tibia. And the smaller bone, it sits off to the side right there. Since it's to the side, and this is their right leg, because this bone is lateral, it's out here. So the lateral bone of the lower leg is called the fibula. As you be based on the names, you can see how people confuse these two. Tib, fib. If you break them both at the same time, we call it a tib-fib fracture. So the tibia, the bone in the front, that's your shin bone. And then the lateral bone of the lower leg is the fibula. On the other leg, on your left leg, the tibia, the fibula would be on this side. It's always to the outside. Right leg, left leg. All right, now we talked about the muscle that runs along this groove right here on this leg. And we call that muscle the tibialis anterior. And right behind it is the tibialis posterior. These are the bones when they are the muscles when they get pulled away. We call those shin splints. All right. So a common misnomer about our skeleton is that this part down here at the tip. This, when you touch these down here, right here, and right there, people go down onto their foot and they touch them bad boys right there, and they say, oh, those are the ankle bones. No, you see, they're not the ankle bones. Those are the distal end of your lower leg bones. The ankle bones actually sit inside these. Okay. So the distal end of the upper bones and the ankle bones sit inside and rotate on those. So when you're touching the outside down there at your leg, where the foot and the leg joins, you're not actually touching the ankle bones. You're touching the lower leg bones. And then the ankle bones sit inside those like that. Okay. Only real issue with these two bones is breaking them. And this is where we just put what's called a short leg walking cast on the person. And they will be out there for 6 to 8 weeks while those two bones, or one or both of those bones, heal. Okay, so the lower leg bone on the front, or the large one, is the tibia, also called your shin bone. The lower leg bone to the side or lateral is the fibula, tib, fib. If you kind of get that into your vocabulary and just go front to side, tib, fib, tib, fib. The biggest bone is the tibia. Now at the distal end of our lower leg bones, we're going to find the ankle bones. Ankle bones are called tarsals. And there's 7 ankle bones. I don't get into naming all of them. 1, 2, 3, 4, 5, 6, and then the big one back here, which actually comes up like this, is number 7. Comes all the way around like that. So 1, 2, 3, 4, 5, 6, 7. As you can see, they all have names. The lateral cuneiform, the cuboid, the navicular, the intermediate cuneiform, the medial cuneiform, and the calcaneus. But that's not important for us to know all of those names. If you ever want to work in therapy, yeah, you'll name them all. You'll learn them all. So 7 ankle bones. The largest of the ankle bones is the heel bone, which is called the calcaneus. And people break their foot commonly, usually because of something falling on the foot. But you can break your heel bones. Imagine what that must feel like. Let's see if I want to try and find a side view of the foot, of the ankle bones. Matter of fact, I might replace the one in the slide with this one. Okay. The heel bone back there. Now imagine breaking that bad boy, what that must feel like. I want to go back here. I'm going to take this out of here and replace it with this one. Oh, I thought I would. Maybe not. Oop, didn't mean to do that either. You can see the bones a little bit better. All right, so the tarsal, or our calcaneus, the biggest of our heel bones. And people sometimes break it right across like that. And they break that heel bone off there. And they'll go and pin it back in place. The best case of that I saw was not as a medic, but as a teacher. Idiot was riding a motorcycle in the school parking lot, riding wheelies, trying to impress the girls. Mm-hmm. You know, one of those little crotch rocket motorcycles, the ninjas, and and I told this fool to stop a few times. And there we are out there again on break. I said, all right, keep going. Mm-hmm, mm-hmm, mm-hmm. And he's riding, he's coming. I'm standing there smoking, like, yep. Hey, car, dude, car, boom. Right into a parked car. Broke both his heel bones. All the students are looking at me like, I'm like, is he breathing? Yeah, he breathing. Well, call an ambulance, shit. I told his ass a few times to stop doing that shit. But anyway, that is your calcaneus, the biggest of our heel bones known as or ankle bones known as the tarsals. The bones of the foot are metatarsals. So this is your ankle bones, all of that together, all 7 of them. The next section are your metatarsals, the bones of the foot. And there are 5 of those, 1 going out to each toe. And then the third section are your phalanges. 1, all of those are phalanges. And there are 14 of those in each foot and 14 in each hand. The finger bones and toe bones all have the same name, phalange. So the bones of the toes and fingers are the phalanges, 14 in each foot for a total of 56. That doesn't need to be in red. You just want to know that these bad boys right there are the phalanges, the bones of the fingers and toes. It's the bone that we have the most of, 56 of them. And why 14? And the hands and the feet are arranged the same. So if you think of the thumb like the big toe, then you have 3 phalanges in each finger, a proximal, medial, and distal phalange. That's why the fingers bend twice, 3 bones in there. But the thumb has 2, so the thumb only bends once. So that's 12, 13, 14 phalanges. And the toes have the same arrangement. All our toes have 3 phalanges except for the big toe, which only has 2. And that gives us 14 in each foot, 14 in each hand, 56. So those are the bones that make up our foot, if you will, the ankle bones, the foot bones, and then the bones of the toes. Tarsals, metatarsals, and phalanges. Now let's talk about phalanges for a minute because we have so many of them. If you break a phalange, one of your finger bones or toe bones, we have to say which one you broke. So we have to be able to point in writing, say which bone the person broke. So we start with, first of all, these are not fingers and toe or fingers and thumb. These are all digits. So we get away from that pointy finger, pinky finger, middle finger, ring finger, and so on. They are your digits. Starting at the thumb, 1, 2, 3, 4, 5 digits. And we are the only ones in the world who do this, by the way. When you count on your fingers, show me how you count on your fingers. 1, 2, 3, 4, 5. That's not right. The rest of the world goes 1, 2, 3, 4, 5. Starting at the thumb, which is the first digit. And that's, you might have seen that movie, Inglourious Bastards. No, yeah, that one. When the guy was in the bar and he wanted to order drinks, so he ordered 3 drinks and he ordered them like this. Yeah, let me get 3. And the other guy that he was talking to, the German guy, knew right away that he was a spy. My friend, in Germany or in Europe, we do this. He should have ordered 3 drinks like that, not like this, because we're the only ones that do that. And when I was watching the Tour de France last year, one of the riders from France, or no, he was from Germany, Marcel Kittel, he won 3 stages, and after winning the 3rd stage, you see him out going 3. Like, yeah, so they really do that. 3. So anyway, 1, 2, 3, 4, 5, starting at the thumb. Now, because we have 3 in each finger, one of them is closer to the point of attachment. Y'all remember what that word was? Started with a P. Closer to the point of attachment. It was proximal. And one is furthest away from the point of attachment. That's distal. The one in the middle is medial. Proximal, medial, distal. In the thumb, it's only proximal and distal. There's no medial. So, where I'm wearing that ring right there is on the proximal phalange of the 4th digit of the right hand. And that's how we say that. The proximal phalange of the 4th digit of the right hand. Now, which one is this one right here? What if somebody broke that phalange?
3rd, number 3,
Medial.
the 3rd digit.
This one out here, the farthest one.
Oh, distal.
Distal phalange of the
Middle,
3rd digit.
Third.
There.
3rd digit,
Okay.
yeah.
So distal phalange of the 3rd digit of the left hand. So that's how we would say in writing which phalange we're talking about. This one right here, I'm pointing to the middle one of the little finger, the medial phalange of the 5th digit of the left hand. So that is how we refer to those in the fingers and toes. All right, so the bones of the fingers and toes are phalanges. The bones of the foot are metatarsals. I don't ask what the numbers are. Just know their names. Ankle bones are tarsals, foot bones are metatarsals, and the bones of the toes are phalanges. Matter of fact, let me go on and do that while I'm here. All right, and the heel bone, the largest of our ankle bones, is called the calcaneus. All right, so that brings us all the way down to the toes and all those bones down there. Let's come back up to, we did the spinal column, we did the rib cage. Now we need to do the shoulder bones and the arms. And you see the first of our shoulder bones illustrated in red, called your clavicle. The clavicle bones, they keep our shoulders pushed out like this. Without your clavicles, the shoulders would turn inward like this all the time. And the clavicle bones keep them pushed outward. So if you break a clavicle, the pressure or the tension being pushed out, break the clavicle, the two bones tend to come towards each other, or the two ends, and the shoulder collapses in like that. Have y'all ever seen, who saw the movie Joker?
I did.
With Joaquin Phoenix? Isn't that his name?
I didn't like it.
I loved it.
Yeah, but I want to know, what the hell happened to his skeleton? Was he born that way, or was he in an accident? Did y'all see how far his shoulder blade sticks out?
His mom's boyfriend would beat him.
It was what?
His mom's boyfriend would beat him to the death.
Really?
Yeah, he deformed him.
Oh, but man, that bone sticks out. The shoulder blade sticks way out, and you see the shoulders turned in like that. So yeah, somebody damaged his skeleton, or he was born like that. But anyway, those are your clavicle bones. So when this bone breaks, right, snaps right across there, those two bone ends are going to push towards each other, and that's painful. So what we need to do is pull them apart. So if your fracture's right there, we need to pull those bones. We need to pull those bone ends apart. And we're going to do that with a splint that's called a clavicle strap. It goes around under the arms, kind of like a backpack. But instead of having a pack on there, there are buckles back there that you can pull and pull the two straps away from each other. Like that. So around over the arms, I don't know why I just around over the arms, and these right here, you pull them and adjust them. There's Velcro right here. So this is the strap coming through and attached to the Velcro over here. You just, in some cases, guys, to get these on correctly, you have the person sit down on the side of the road, because these are put on right there at the accident scene. You were like, oh man, your clavicle's broken. All right. So have a seat, boom, put your knee in their back and pull these straps and pull them back like this. And that's how they go to the hospital. And when they get into the emergency room, the doctor's just going to adjust the straps down to where the bones come real close together, and boom, send them home. And you'll be in this strap for however many weeks. And so this is the one thing where we'll do the treatment. The treatment that we do at the side of the road is the same thing that you'll wear from now on until this heals. We'll put you in a clavicle strap. There was one football game where Tony Romo broke his clavicle in 3 places. And
Does it hurt?
Oh yeah, it hurts like crazy. Until you put this on. Once you put the clavicle strap on, the pain goes away. But the pain comes from the two bones hitting each other. Clavicle strap pulls those apart. So now you're good. And they were, we were at a bar at that game. I was there with a couple of friends. And there were some people who weren't part of our group. They were medical people. They weren't medical people. And you could hear one of them, you could overhear the guy saying, oh, look at him. He's right there on the sideline. Now, how he broke his bone in 3 places and he not gone to the hospital? It was obvious that he was in a clavicle strap. Once we put you in that thing, you stay there and watch the rest of the game. Go to the hospital afterwards, and the doctor will adjust the clavicle strap and send you home. So it relieves. Don't get me wrong. There's still some sensation there. There's still some aching there, but you're not totally pain-free, but enough that you could stay there and watch the football game, watch the rest of the game before you go to the hospital. So that's a clavicle strap, and putting those on when somebody has broken their collarbones. All right. So I want to do the attendance right now. So let's do that. Oh, the glass. classes. All right. So I'm looking for Elaf is here. Nicole is here. Delia is here, right? Yeah. Michelle Chestnut, you here? I see you. Christopher is here. Cheryl is here. Chloe Eddingfield is, where's Chloe? There you are. Rebecca is, where's Rebecca? Rebecca, where's Rebecca?
I'm here.
Where? Why does it say Nicole Turner?
Yeah, I need to fix that.
Like Tina Turner. Destiny Garcia, where you at?
I'm here.
Okay. And then Cassie. Cassie Garcia. Cassie. No. Elena Guzman, are you here? Where's Elena? Elena, there you are. Isaac, oh, there's Cassie too. I didn't see Cassie. Isaac, Danielle. Lopez, Danielle. Okay, Maricela,
I'm here.
okay. Tatiana, I don't see Tatiana. Okay. Maria Martinez, Maria, you are. And then Monica is here. Chloe McDaniel, Chloe. Anyone? No, Chloe. Okay. And Jose is here. Wendy is here. Lionadra, didn't see her. Christy is here. Sarah is, where's Sarah? Sarah. I'll see you up there in the corner. All right. And Carissa is here. And Esther. Where's Esther? I don't see Esther. All right. Esther Torres. All right. So I'm going to say something here just for a minute before we go to break, and I go turn this in.
Did you mark me, Mr. Mahone?
Was that
Dahlia.
Dahlia? Yes, I got you.
Okay.
Okay. Now, I know some people, when I say your name, you're like leaning forward, trying to find the microphone and that type of stuff, and it takes you a few seconds. But if I'm saying your name and you're not saying anything, that means you're not sitting here. That means you're logging into the class and then you're going off doing whatever. And you come back a little bit later and you're there and you send a text to somebody or a chat. Did he take roll yet? Yeah, I did. And you weren't sitting here because you're not answering to your name. Now, remember, Mr. Mahone's not the cheat monitor, man. You know, if you're not attending class, you're just logging in so that you can be marked present, and you're not really sitting there participating in the class, you're only hurting yourself. And 2 modules from now, you're going to be down there going, what does enter mean? And you're going to be behind the power curve trying to catch up with everybody else. There's going to be something we talked about in class. You're going to have no idea. Like we're going to do an entire day and a half on the heart. And if you're not sitting there, when you get into your EKG classes, yeah, you're going to be like somebody walking right in off the street when Mr. B's talking about the cardiac conduction system and the SA node and the AV node and all that mess. And you're going to be totally lost because he's going to be trying to explain to you what words like cardio means and upper chambers and lower chambers. Mr. B's not going through all that again. The aorta and the valves in the heart. He's not going to cover all that again. He's going to go straight into the cardiac conduction system because he knows Mr. Mahone has already done the anatomy of the heart and he's going to go straight into the physiology. And guess what? You're going to have missed it because you logged in, went to clean your house and come back over and sit down wondering if Mr. Mahone took roll already. So it does puzzle me sometimes when I'm calling names and I see the person's name on the screen, but the person isn't answering. I know exactly what you're doing. So Mr. Mahone's been around for a while, y'all. I'm not young and dumb. Tell y'all a story. When I was in basic training, when I was a drill instructor, I came in one day, just out of the blue. I went in the utility room, took one of the mops, and I poked up on the ceiling tiles. And the ceiling tile popped up, and all this candy and chips and shit dropped out of there. So now I'm sitting in my office after I ring them a new little yell and scream for a little while, blah, blah, blah. I go back in my office, and I can hear them out there. Somebody snitched on us. I don't need somebody to snitch on you to know that trainees hide shit in the ceilings. They've been doing that since I was in basic training. What, you think you're so damn smart, you're the first one to ever think about that? That in order for me to figure it out, somebody had to snitch on you? I've been around for a while, y'all. And I know that there are students who are logging in, who are going and cleaning their house or walking their dog or whatever. Guys, it requires a certain amount of discipline. But I'm not going to be the one that sits here and tries to make you sit up in class. Okay? Do what you got to do. But you're still going to be held accountable for all this information. If not part of this class, in the later classes down the road, you're going to see all this stuff again. All right, so let's go ahead and take a break while I go on and walk this around. One more thing before we take a break, guys. There is a form now in place that we need to fill out at the end of class. So if you're not going to be in class, contact me somehow and let me know. Mr. Mahone, I'm not going to be in class because I've got to go to work today or something. Otherwise, they're telling me that I have to email you or call you and try and find out why you wasn't in class. I'm not about to do that shit. If you're not here, you're not here. I'm sorry. If you tell me why, I'll put it on the form. But if you're not contacting me, I'm going to write down you had an appointment or something. I am not spending my afternoons trying to find you. Okay? Be professional, be disciplined. Let Mr. Mahone know why you're not here today, okay? Or why you're not going to be here today. And some of y'all have been doing it, and I appreciate it, by the way. I know if I'm in the middle of a lecture and somebody says, oh, Mr. Mahone, I have to log out. Yes, thank you. I appreciate that. I might not say it at the time, but thank you. I do appreciate that. Let me know, just being professional. The same way you would at work. Boss, I'm going to be an hour late, or I'm not going to be there today. So contact me somehow. Let me know where you are, why you're not in class today, so that I'm not taking an hour trying to fill out this freaking form. And so I'm not lying on the form, oh, they had an appointment today or whatever, because it's just not my bag. So anyway, that said, let's go ahead and take a break. Come back at 25 after. That gives us 15 minutes. And I'll go get this thing turned in. There's way too many people to be absent today.
He's still on break.
Good morning, Miss Cheryl.
Good morning.
Okay, we're back. Sorry about that, guys. I had to have a conversation. Who is Tyler A? Who is that? Tyler A. There's somebody's name on here. Okay, so Tyler A is obviously not listening right now. Okay, well, like we said on break, I can't, before we went to break, I can't, you can lead a horse to water, but you can't make him drink. Right. So whoever is Tyler A is either using a phone or something for their audio, or they are not here today. All right, so anyway.
Mr. Mahone.
Yes.
Sorry, did you call me here?
Who was that?
Carissa.
Yes, I did.
What was that?
Yes, I did.
Okay, sorry, I'm just checking.
All right. Where were you when I took attendance?
The restroom.
Ah, okay. Yeah, okay. Good answer. Okay. All right. Yeah, we all got to pee sometimes, I guess. All right. So anyway, so we talked about the collarbones, also called your clavicle is the actual name for those. And moving on then to the shoulder blades, which are called scapula. We talked about these a little bit when we mentioned the spine of the scapula and the muscles of the rotator cuff, all located around the scapula. This area right up here is the area that I was talking about, where you put your hand when you want to give somebody a deltoid injection. Place the hand right on top of that bone right there. Roll your hand over and give the injection underneath your hand like that, 4 fingers down. So again, using the skeleton to point out areas where we do procedures on folks. Cheryl, why are you here twice? I'm like,
Sorry.
who's this?
Earlier, my computer wouldn't boot up because I live very close to town.
Oh,
so
okay.
I guess when y'all died, I did too.
I was like,
so I had to put it on my phone, but I can't take it off.
Oh, okay. I was like,
sorry.
is Cheryl a twin? Is that 2 of them? Why am I looking at 2?
No.
Okay, but anyway, so that is your scapula, this big bone right there. And then the clavicle. So we're looking at this from the front. And so this is their left shoulder. And you see that the clavicle and the humerus make the cup, or excuse me, the clavicle and the scapula make the cup that the upper arm bone rotates in. Okay. All of that coming right together as a nice tight joint right there. Okay. Now, I want you to imagine the muscles here on the arm, the ligaments that keep this shoulder in place, the capsule that encapsulates the entire shoulder joint, then the muscles that are on the scapula, the nerves and blood vessels that run down through here, all the musculature up here on our with our trapezius and so on coming out to the shoulder. And with all of these structures in place, look at a place where you can pass a bullet through here and not do some damage. I bring that up because what do you see on TV all the time? People getting shot in the shoulder. And it's not supposed to be a big deal. Like, oh, I got it in the shoulder, so I'm okay. It only went through my shoulder. Okay. I had one client who was shot in the shoulder. He was a San Antonio policeman. His name was Michael Munoz. I don't mind saying his name because he's been in the news twice. The first time was when he was shot in the back at a Denny's restaurant, 4 times. 3 of them went through the back and the 4th one went through the shoulder. And it was the one that went through the shoulder that he was coming for therapy for. And it was a year before he could return to the police department because of a gunshot through the shoulder. And then once he got on the force, he was in the news again. He was one of those policemen that were going out. I don't know if y'all remember this, but they had this scam going with some of the prostitutes in town, making them pay off the police and have sex with the police for free and that type of stuff. So he was one of them dudes. So anyway, TV makes all kinds of stupid ideas in people's mind, that being shot through the shoulder is no big deal. Okay? You may not ever be able to lift that shoulder again, or you might be limited to 45-degree shoulder abduction. We talked about that and the types of things that you can't do. The reason that he couldn't get back on the police force is that, believe it or not, they have to be able to get out of the car within a certain number of seconds, and he couldn't do that. His shoulder was that jacked up that he couldn't reach over, open the door, and get out the car. So they test him on that, the ability to get in and out of the car and draw your weapon and all this mess. So he couldn't pass the get in and out of the car test within the certain number of seconds that they were supposed to be able to. So anyway, that is your shoulder blade and all the structures running through the shoulder. Now we'll talk about the upper arm bone here in just a minute. We'll name that bad boy. But what if this bone slips out of the socket? That's a dislocated shoulder. Now we can get that thing back up in there, no problem. But remember, the ligaments that hold it in place, they've stretched when that shoulder comes out of the socket. And now we'll move it back up in place, but now these ligaments are permanently lengthened, which means that you can pull this shoulder out of the socket pretty much anytime you want now. But every time you do, you're stretching those ligaments even more. And eventually you're going to need a brace to actually hold your shoulder in place for you. So a dislocated shoulder, even though they're easily popped back in place, they can also be lifelong issue now, that your shoulder just dislocates all the freaking time now, okay? Especially when you go to pick something up. And your wife say, babe, come help carry the groceries in. And this child, y'all, my wife, I don't know how she does it, but she gets back to the house and the trunk is just filled with shit. It takes us an hour to carry the damn groceries into the house. And there'll be like 12 of the 12 packs of, what's this stuff? Ginger ale. And somebody's got to carry all this stuff in the freaking house now, man. You know, it gets on my nerves, her and her damn shopping. But anyway, this guy, you're carrying groceries in the house and boom, your shoulder becomes dislocated. Oh, babe, I need you to pop my shoulder back in for me. So it can be a lifelong thing, barring surgery, where they get in and cut through all those structures just to get in there and shorten your ligaments a little bit. So that is your scapula, your shoulder blade. All right. Now the upper arm bone is called the humerus. Pay attention to the spelling. And that's why people often call it the funny bone. And if you ask somebody out there in the world, Dad, why they call that the funny bone? Oh, because it feels funny when you hit it. No. It's funny bone because its name is humerus. Okay. So that's the humerus, the upper arm bone. In the lower arm bone, there are two of them, the radius on the thumb side and the ulna on the pinky side. And that's how you'll be asked on your assessment, your test. The lower arm bone on the thumb side is the radius. And on the pinky side, it's the ulna. Now remember that everything that we do is, or everything on the thumb side is radius. Remember the radial muscles are over there? The radial artery, the radial nerve, all pass down the thumb side. The radial artery is where you check a person's pulse out there on their wrist. On the other side are the ulnar structures, the ulnaris muscles, the ulnar nerve, the ulnar artery. They all run down the pinky side. So make that association. Thumb side, everything is radius. Pinky side, everything is ulna or ulnaris. All right. And I'm going to bring up this picture to show what happens when somebody hits their funny bone. Okay. When you hit the funny bone, first of all, you are not hitting the humerus. That's a misnomer. You're actually hitting the ulna bone. The radius right here, the ulna right there. There's a nerve that comes down the back of your arm, and it travels through this space right here, and then continues down the arm. That's the nerve that's pinched up in my upper back. The same nerve that you push when you hit your elbow right there. So if you impact the elbow right here, it's going to pinch that nerve in there. And that gives you that sensation in your arm. Ooh, ooh, yeah. I hit my funny bone. You pinch the nerve in there. Now, for me, it's pinched up here at the upper back. So I get that sensation in my arm all the freaking time, especially on like cloudy days. It's pretty cloudy out there today. I'm feeling it today. Comes all the way down to my pinky finger. And it's a pretty annoying sensation. You learn to live with it. One day when I was teaching a class, at one point, y'all, that thing flared up, and it was giving me sensation for about 2 weeks of constant funny bone sensation down your arm. Imagine that as you get older. So again, these are things that are going to be lifelong because it's my skeleton that's the issue. And these bones just won't reposition themselves. So that's what's happening when you hit your funny bone. You hit the elbow right there. That pinches the nerve in there and gives you that sensation that goes both up the back of your arm, but also down the arm. Because this nerve, unfortunately, is a mixed nerve. It carries sensations in both directions. So you're going to get it in the back of the arm and also down the length of the arm all the way to your pinky finger. All right, so that is what's happening when people are hitting their funny bone and the bones of our upper and lower arm. The upper is being the humerus. The lower arm thumb side is the radius. Lower arm pinky side is the ulna. All right. Now at the distal end, we have the same arrangement that we have at our ankles, is that the bones that you feel right here, and people tend to call those wrist bones. Doggone it, I am so backwards, y'all, on this video. Those are, people tend to call those your wrist bones, but they're not. They're the distal end of your radius and ulna. The radius over here on the thumb side, the ulna on the pinky side. Your wrist bones, in order to touch the wrist bones, you have to go a little bit further. So go to those two prominent bones right where your hand starts and go a little bit further. And then you're inside the wrist bones right there. Okay. So the wrist bones are called carpals. There are 8 of them, and you see their names over here. I don't get into naming all of them, but I do talk about one of them. And that's the yellow one right there, the one that looks like an egg. Right there. It's pronounced piezoform or pisiform. And the reason I bring that up is because this is the bone that's most often broken when a person breaks their wrist. So when somebody says they have a wrist fracture, 9 times out of 10, it's going to be the pisiform. Where do you find it? Right on the pinky side, right there.
Mr. Mahone, what about on top of your wrist or like on top of your hand?
Up here?
Yeah, a little bit more in the middle. Where the green is?
Right here?
Like capitate or precipitate?
Capitate? Okay.
Yeah, decapitate.
Yeah, it's broken some. They're all broken. Can be broken. But
every time I punch a wall, that swells up.
Oh, poor thing. Yeah. Why would you punch a wall?
Like,
Have you just broke it, Miss
Yeah,
Mom?
yeah, wingnut.
It was someone's face, but yeah.
Yeah, when punching the wall because you mad at somebody else. Anyway.
No, their wall was their face. Every time I get in a squabble, that shows up.
Oh, okay. Or whenever you punch somebody. Okay. Let's
Yeah.
stop punching people.
I don't know more. I'm saying.
Hey, doc,
That's
it hurts.
why is that so?
Hey, doc, it hurts when I do this. Okay, don't do that. Yeah, stop punching people. Oh, geez. But anyway, the mesophorum is the bone that's most commonly broken.
Pop-Tart.
Oh, Pop-Tarts. Yeah, who's got Pop-Tarts? I want Pop-Tarts too. I want adult Pop-Tarts though. Toaster strudel. Hey, yeah, boy. Don't mess with me. Oh, look at those two. Hey, y'all.
Hi, Mr. Mahone. Hi, Mr. Mahone.
See y'all. Okay. So the piezoform. Why is it broken so much? When you break the piezoform, usually that's referred to as a boxer's fracture. You hit somebody and you shouldn't have. It happens to women a lot because y'all are limp-wristed punchers. Yeah, y'all don't know how to punch. So yeah, punch somebody and boom, here's what happens. The hand interacts the thing and boom, the wrist collapses down just like that and breaks the piezoform right there. This is the reason that boxers tape their wrists before they put their gloves on. Y'all ever seen that? The wrist around the wrist and then up through the knuckles. That's all tape. And it helps them from breaking their knuckles, but also gives stability to the wrist so that when they punch, it doesn't collapse. Okay? And they don't break the piezoform right there. So start wrapping up your wrists before you punch people. Get mad at your boyfriend, say, excuse me, run in the bathroom, wrap up your wrist, then come out and punch. Ideally, guys, don't punch with your fist. If you have to hit somebody, hit them with the heel of the hand right here. So get your fingers back out of the way. And you might have seen them do this in, I don't know, Taekwondo and stuff like that. Get the heel, the wrist, fingers back out of the way and hit them with that part right there. Hit them in the nose, in the chin, or in the neck. Either way, they're going to stop messing with you long enough for you to get away. So, and you know, women tend to punch at the face anyway because y'all get emotional. Yeah, and what is the face? See, that's what you're mad at. You see, you got all these other structures down. Remember, this is the weakest part of our anatomy right there. But you punch towards the face because that's what you're mad at. Punch at the neck. There was a video just the other day I saw on television where the guy just chopped the neck and the person went down. That hand chop, that shit works, y'all. To the front of the neck, boom, just pow, and collapse that cartilage right there. Too often when somebody's bothering us, we try to move away from them. And when we step back from a person, we put ourselves right in punching distance. When somebody's bugging you, get in their face. It's harder to punch you when you're up close like that. Okay? They can't get any leverage behind the punch. Even if they come around and hit you in the back of the head or in the ribs or in the back, there's no leverage to that. Get in their face. If they're holding you, that's even better. Does somebody grab you and hold you? That's even better. Get up in here and pop their eardrums like this. Even that's uncomfortable as I'm doing it. So imagine if you did that over their ears with full force. You pop their eardrums. If you can't punch, then put your hand on the thing and just push as hard as you can. If your arms are free, grab one side of the head, the other side of the jaw, and just push opposite directions. Yeah, I promise you, these people will let you go long enough for you to run away. Don't be standing there acting bad now, okay? Because you, blah, 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 you broke their nose. Now you're going to stand there acting bad. Now you better run because they're probably going to kick your ass in a minute. My daughter came home one day and she had her pepper spray hanging on her key ring. And I was like, oh, sweetie, what's this right here? Oh, that's my pepper spray, Dad. Oh, really? Check this out. It irritated, but it would not stop me from doing what I was doing. And the thing about a weapon like that, guys, is that if somebody else knows what it is, what happens if they snatch it away from you? Now they can use it on you. You need to carry a weapon that nobody knows it's a weapon. It's a little stick about the size of a whiteboard marker. You carry it in your, and this one's kind of good because see how it's narrower at the end? You hold it in your hand like this and put key ring down there or whatever. And that's how you walk with this thing in your hand. If somebody bothers you, if you take this thing and you put it against them and push, it's going to spread their ribs. It's called a rib spreader. It's a little stick that's narrower on the end, comes almost down to almost to a point. And there's no law against carrying a pointed stick. And this thing hit them in the chest with this, and it will slip right between their ribs and push their ribs apart. And I promise you, that person will be shocked enough to let you go, and then you can run. So that's a rib spreader. You find them at the martial arts stores where they sell the nunchucks and the throwing stars and all that. Just ask the person, do you have a rib spreader? And boom, right in there. And you also get them at like police seminars and stuff like that, self-protection for ladies and all that mess. So anyway, any weapon that somebody knows that you have, there's always a chance they can snatch it away from you and use it against you. That's why I think open carry is probably the dumbest thing on the planet, to walk around open carrying a gun. What's to stop me from walking up behind you, putting my gun at the back of your head and taking yours? Not a damn thing. Now I've got 2 guns, you've got none. What are you going to do except get mad? Okay. So open carry is just dumb. You got a weapon right out there that somebody knows, sees it, knows what it is, and knows how to use it. It'll snatch you right out your holster and shoot you with it. So anyway, that's Mr. Mahomes' martial self-defense class. Okay? Don't be trying this stuff at home because it does work, y'all. Don't be trying it on your boyfriend because you get mad and going to chop them in the front of their neck. You break their freaking cartilage. And then you're in court. Did y'all see it was the first 48 episode where this girl got mad at her boyfriend and poked him with a knife and then ran out of the house? And they went and found her, brought her to the police station and told her that he died. And she's just trying to, she's just upset. So she's just going to poke him.
You don't do stuff like that.
And she got
That's so crazy.
She got 22 years.
I'm scared to go to
Young
jail.
girl.
Dang,
for a
so
poke. Scary.
Yeah, she was about 18, 19 years old. Just going to stab, or 19 or 20 years old, just going to poke him because she's mad at him, and ended up doing 22 years in prison. So don't be playing around with this kind of stuff. Mr. Mahone, I can kill you with a drinking straw. Yeah. See, one of those Rambo type people taught me how to do that over at Fort Sam Houston. He said, hey, Mahone, come here. Let me show you how to kill somebody with a drinking straw. All right, show me. Oh, damn. Let me try that. And
Jam it up his nose.
what he did was something from Bill Nye, the Science Guy, where you took a drinking straw and pushed it through the potato all the way through, just like that. And if you can push it through a potato, guess what?
It's, yeah.
Right up into their neck.
The edges are jagged, yeah.
I like Jason Bourne. I know everybody like John Wick. John Wick will shoot everybody and but Jason Bourne will beat your ass with a magazine. Y'all see that episode?
Yeah, I love that man.
That man picked up that magazine, rolled it up, and just started whooping that guy. So I'm like, damn. All right.
With the pencil.
Or the one with the ink pen.
Yeah.
And that guy ended up with it stuck in his fingers. Now, I tell you what, that guy, badass assassin dude, anybody else, you stick an ink pen in their hand like that, oh, they're going to leave you the hell alone until they figure out how the hell do I get this out of there? The guy just snatched it and came on with the fight. You out there in the world somewhere, do that to somebody, there is no way they're going to continue with the fight. You just stuck the damn ink pen down in their hand like that. So anyway, so I like Jason Bourne, y'all, because Jason Bourne will beat your ass with anything that happens to be there. John Wick got to reload and all this mess. Jason Bourne just beat you up with a magazine. All right, so anyway, that is your carpal bones. Now, if you break one of these bones, guys, this is where you're going to get into some dramatic type of splinting. Because, for example, if you break the bone right under here, we're going to have to take the pressure off of that while that heals. So your cast is going to have your hand back in this position. And you'll be walking around like that for 6 weeks or however long it takes. Or in this position or that position or whatever we need to do to take the pressure off the bone you just broke. So you see some pretty dramatic wrist splints with people's hands being splinted in all kinds of crazy positions. And if you get into splinting or casting, putting casts on people. Has anybody ever had a broken bone before? Anybody ever have a cast on?
Yes.
Okay.
I got hit by a car.
You got hit by a car? Oh.
Well, when I was like 10, though.
Oh, poor thing.
30 now.
I remember when we were kids at the grade school, we were patrol boys. They still have those? Patrol boys and girls. They
I
give
remember
you
those.
the little orange thing, stripe thing.
Yeah.
And you help the little kids cross the street. Well, we're patrol boys. And you know how they let you out of class about 5 minutes early so you can get down to your corner and that. So we're down there on the corner waiting for the bell to ring, acting a fool. And Kenneth Goins runs out into the street right in front of a car. Hit him so hard, y'all, he flipped up in the air. And I'm not kidding. He hit the ground. And we were moving towards him. And I noticed his shoe came down over here. After, like seconds after.
Wow.
Like it went up, boom. Like, oh, damn. And then, boom, the shoe came down. Oh, shit.
That's a hard hit.
That knocked the shit out of him. He came back the next year for school, and he had one of those thick shoes. Now, what happened to him? The bone itself, the fracture is called a comminuted fracture, where the bone ends have been, or the bone has been shattered in there. So, for example, your femur bone, if you get a comminuted fracture from a gunshot or from a car hitting you, then the bone ends or the bone pieces are going to come out of there. And you're going to end up with a space in the bone. Now, that's too far to grow back together. So what they did was pull the two ends together and then gave him that thick shoe to walk on.
Well, I had like 3 different casts. I didn't have a shoe.
Oh, yeah. They had to keep redoing it because you were growing. Yeah. When you're a kid and you get a fracture like this, we may have to take your cast off a couple times because the bone is growing in there in length as well as repairing itself. Today, they won't do the thick shoe thing anymore. Today, they're going to put a fixator in there. A fixator is metal, and it screws into the bones, keeping them in their normal distance. So pinned in here and there, and right here will come up as a little shelf that carries your weight. So rather than bring the bone ends together, they'll put a fixator in there. So you shouldn't see that thick shoe anymore. But anyway, so that's how we do comminuted fractures when the bone ends have been splintered like that. We've got to fill that space somehow. And so we put a fixator in there. And the fixator will be permanent. We know we don't take that thing out or anything. All right. So if you've ever had a cast, you know that those things itch.
Oh my goodness.
They itch like crazy.
I was sticking pencils, all type of stuff in it.
Now, think about this now. Your arm is down inside this cast. The skin is real dry, and you're reaching down in there, scratching it with something. What happens if you cut your skin right there? And all the bacteria. What did this cast smell like when they took it off?
Oh my goodness, horrible. And then my leg is all like dry and
that's all that's all the bacteria in there. So if you cut that, imagine the bacteria getting into that cut now. The good news today is we don't use plaster casts, or rarely do they use plaster casts anymore. They use fiberglass casts. And fiberglass casts can be bivalved, meaning that we put the cast on you like normal, wrap the material around there, let it dry, and then we cut the cast down the length on both sides, front and back. And that allows you to take the cast off,
Right.
in care, and then put it back on.
Oh man.
As long as you, and then wrap an ace wrap around it, and that holds the cast in position. So we bivalve the plastic or the fiberglass cast. Plastic casts can't do that. They'll fall apart. They just crumble and fall apart with the slightest bit of moisture. Fiberglass casts can also be gotten wet. We don't advise you to swim in it or take a bath in it or anything like that, but it doesn't break down if it gets moisture on the cast itself. Plastic cast would break down right away. So the fiberglass casts, you've seen them out there. They're pink, they're purple, they're green, they're blue. They have all these pretty colors to them. Back in the day, it was strictly white because it was just So when I was in practice, I was using plaster casts. And at the family practice clinic in California, we did all the casting for the entire hospital. So if you were seen in the emergency room with a broken arm, they sent you down to the family practice clinic, and we put the cast on down there. It's because we're a teaching hospital, and the doctors down there needed that type of experience. So we did all the uncomplicated casts. If you had one like a wrist cast like that, they sent you over to orthopedics. But for just a broken arm, broken leg, we put those casts on. So I've had a lot of casting experience, but it was all with plaster casts. I didn't start using fiberglass casting until I got into occupational therapy. All right, so those are the bones of the wrist, the carpals. Now, these bones have to actually be held in place as well with a ligament that goes across there called the carpal ligament. And it's like this bracelet right there. It holds all those bones together like a puzzle piece or like puzzle pieces. But it also causes some problems for us. The nerves that come down our arm, the radial nerve at the thumb side, the ulnar nerve at the pinky side, and then the median nerve. It actually comes underneath the carpal ligament and goes out to service your palm. But if you move your hand back and forth a lot, or if you keep your hand in this position for a long time, it puts pressure on that nerve, leading to the carpal tunnel syndrome. The space where the nerve passes underneath the ligament is called the carpal tunnel. And that's why it's a mixed nerve, and that's why carpal tunnel syndrome irritates the palm, but also the arm. The nerve passing right underneath there, going out to your palm. So the way to treat that is to cut the carpal ligament. But then what's going to hold your 8 bones together? The brace that we give you. So we'll give you a brace to wear. It's a carpal tunnel brace. And you'll wear that whenever you do the activity that led to your carpal tunnel syndrome in the first place. If you're a typist, then you'll wear it when you type. So carpal tunnel is a pretty irritating sensation. My aunt was a typist, like at a law firm. And man, she had carpal tunnel on both sides. And they had to do carpal tunnel release on both of her wrists. So it's a pretty irritating sensation. Again, going in and cutting that ligament to relieve the pressure in there. So that's what carpal tunnel syndrome is. The median nerve coming underneath the carpal ligament being irritated by positioning of the hand or by constantly moving the hand like that. So those are your carpals, and there are 8 of those bad boys. The bones of the hand right here, 1, 2, 3, 4, 5. Those are the metacarpals. And again, you can damage these with crush injuries to the hand. If you've ever thought, or if you think you might want to ever work in therapy, there are people out there who do strictly hand therapy. That's all they do. So you damage your hands, you come in and you see them, and they will work with you on restoring function to your hand. They're hand therapists. It's an offshoot of occupational therapy. So if you wanted to do something like that, you'd first get your associate degree in occupational therapy and then specialize in hand therapy.
I have a question.
Right. Yes.
What happens if, like, you break one of those fingers and you don't get it fixed?
Oh, poor thing, it's gonna be crooked.
Like, okay, but it won't damage like the function of your hand.
It could, yes. Yep, definitely. For example, if you break a hand bone,
Well, I broke
and,
my
and
pinky,
it
so
and
give me Z.
it moves out this way a little bit, and then heals. So now your bone has a little angle in it. It may still work, but remember, it's going to put pressure
Wait, come
on
back.
anything over here. So all the tissue over there is being squished by the crooked bone right there. So yeah, we got to get that thing realigned so that it's nice and straight. And that's called reducing the fracture, reducing the angle in that bone. We take that and straighten that out. That's a reduction. We've reduced the angle in the fracture. All right, so yeah, it doesn't mean that it won't work to not have it reduced and realigned, but it could cause some issues by pressing on tissue around it. I have one in my foot. Evidently, I broke my foot before and never did anything about it, just limped on it for a little while. I don't even remember when I did it. Must have been when I was a kid. But there's a bone that sticks out on the side of my foot just a little bit. One of my metatarsals sticks out on the side of my foot just a little bit. And I know it's not an anatomical thing because it only happened on one foot. So I broke that bone and shifted it out of place at least. So now it kind of sticks out over there a little bit. Gives me some problems with my shoes sometimes. I actually wear 2 different size shoes. And they won't give me 2 different size shoes. So one of my shoes is bigger on my foot. My right shoe, I wear 10 and a half. And my left shoe, I wear 11. So I buy 11s, and that means that my right shoe just kind of shuffles around on my feet a little bit when I walk. That probably came from all the marching I did in the military, especially as a drill instructor. We marched everywhere, all day, every day in the damn San Antonio heat, ground pounding up and down the damn street. And now my feet are just wider than they were when I started. So that's why I wear 11s instead of 10 and a halves, because one foot is wider than the other one. All right. So was there anything else about, there was something else about the foot I wanted to mention before we moved on. We've already done the fingers, the phalanges, the bones of the feet, and oh, I know what I wanted to mention. Back in the day, in 1935, they discovered the tomb of Tutankhamun, King Tut, and they were all really excited about it and everything. The mummy was still there, the whole 9 yards, so they had a complete intact tomb. So they still have King Tut's mummy on display in, it's not in the Cairo Museum, believe it or not. It's in the London Museum in the Louvre, because it was Londoners that found it. And for generations, they've been trying to get them to bring the King Tut treasures back to Egypt, like they should have, and they should have left them there in the first place. But they're all in London. They've always wanted to image the King Tut mummy, do an X-ray of it to see, the mummy inside there. But they never would let them, because they didn't know how X-rays would affect the mummy itself. When they went into King Tut's tomb, they found a bunch of canes. And they all thought that they were ceremonial canes. You know how you see the Egyptians standing there holding the things, the little thing over here and the little thing over there. And they thought all of this stuff was ceremonial. King Tut had over 100 canes in his tomb, C-A-N-E, canes in his tomb.
Because of the form, right?
In 1 year, they finally let them do an MRI on the King Tut mummy, because the MRI doesn't use X-rays. And they found out that King Tut had a club foot. Those canes were not ceremonial. Those were walking canes. His feet were shaped like, I saw it a little bit earlier, down here. Like that. One of his feet was turned inward like that. That's a fracture, but one of his feet was turned inward like that. That's called club foot. So King Tut actually walked on the side of one of his feet with the cane over there for support. So that's pretty cool. That because they always try to portray King Tut as the warrior boy and all this. There was no way he was a warrior, not with a club foot. And he had that. He was born with that. Children are born with club feet. And they're kind of not easy, but they are repairable. Yeah, so King Tut had one of these, a foot turned to the side like that. Sometimes it's both feet, sometimes it's just one. Now, these can be repaired with what we call sequential splints. They'll put a splint on this leg, just get the baby used to wearing this splint on there. So the first one will be exactly the same as the feet are. To just get the baby used to wearing them. But then they'll be constantly, the next time they'll come in after a couple of weeks, they'll be shifted just a little bit. Put that one on, that'll put pressure on the feet. The baby, it'll be uncomfortable. And then 2 weeks later, another one. 2 weeks, 2 weeks, 2 weeks, 2 weeks, and eventually get those straightened out. But it's got to be done as soon as possible while their skeleton is still growing. If they get to adulthood, it's too late. Or pass through puberty, it's too late. These ankles are going to have to be broken and then everything realigned. So sequential sprints are used for babies. Their bones are still developing and they're soft. So it's real easy, not easy, but able to move those feet back out straight again just using splints. If they get too old, we're going to have to go in and break their leg or ankles in order to get those straightened out. And this person obviously is in an area where they just had no health care or no option for treatment for this kind of stuff.
I want to know why he got shoes next to him.
Yeah.
Sorry.
Another issue that happens with children that we should talk about at the legs is called rickets. Extremely bowed legs. These are children with calcium deficiency. They didn't get enough calcium in their diet, and as a result, their bones are so weak that they can't hold the weight of their body. Our legs holding us up straight, but the weight on their legs just pushes their bones out. And they have these extremely bowed legs like that. But understand that it doesn't always push outward like this kid. You see the same thing, but instead of both being bowed outward, one leg is actually bowed inward.
So what is that picture of the wrist on there? It's like the only picture of the wrist.
Where? Oh, right here?
Yeah.
Oh, I don't know what they're showing right there. Probably the swelling right here. But if that's swelling, why would they put a band around there? Yeah, I don't know what they're showing right there. It's under the rickets picture.
Mm-hmm. It looks like something wrong with their wrist, though. Like
the bones.
The bone, yeah. Maybe it's like spaced out there, so it looks like they pulled apart.
So, yeah, I'm sure you can see rickets in other parts of the skeleton, but remember the legs are going to be so dramatic because they're bearing the weight. So that's the weakness in the bones is not only happening at their legs, it's happening in their entire skeleton. So I'm sure that that's a doctor showing how to identify rickets in the hands or arm. And it doesn't look real dramatic as far as the legs do. All right, so that is rickets and those extremely bowed legs. All right, and what do we do with those folks? Calcium. Calcium. Now, this is an adult. Look at that. Okay. So, again, these are people that if it isn't treated in childhood, it's going to continue into their adult life. And there's a guy that works in this building. I don't know where he works, y'all, but this dude is so bow-legged. And he's an old guy. He's like my age, at least. And when he walks, it's like just swaying back and forth because his legs are just so freaking bowed. And I'm like, whoa, really? They couldn't do something about that? Or, you know, maybe they just didn't have bone. And I saw a kid come into the Valero one day. And his legs was so bowed, he was walking on the sides of his feet. and he was about, I guess, maybe 3 or 4 years old. And I just wanted to say, hey, man, look, just take the kid to the clinic. I mean, here in the United States, they'll fix that kind of shit for free, just for the chance to be able to do it. Student doctor who has never done one before. Have y'all been to University Hospital? It's part of University Hospital, but it is University whatever right up here on Babcock. Guys, you know they do dental work for free? Yeah. If you walk in there, and those are all student dentists, just go in there and show them. And if it's something that one of the students wants to take on, they'll take you on as a patient. But all your appointments will have to be on the day that that student has class. But don't get me wrong, it's not just some student sitting there working on you. Their teacher and all that is there with them as well. Over at, Kaplan up on San Pedro, there's a dental assistant program there. And they do dental work for really reduced prices. For example, if you need a filling, they might do that for $20. Now, the dentist is a real dentist, but the student part are the assistants. So it's a real dentist sitting there doing the work, but their assistants there are students. And they take on real dental cases. So there are places around San Antonio, especially as big a learning facility as we are, or a learning city as we are, as far as medical goes, there's ways to get stuff done in San Antonio. If it's just, go over to University Hospital and see if there are students over there that take on that kind of stuff. So anyway, something like this in the United States, especially in San Antonio, with all the teaching we do here, this is actually what that kid looked like. I'm like, man, get that kid over to someplace. Jeez. All right, so anyway, that is rickets. When we see it in adults, we call it adult rickets. All right, so that brings us to the metacarpals. We've already done the phalanges, 14 in each hand. So the last bones we're going to talk about are the bones of the middle ear. I'm not going to test on these because we're going to do that testing when we do the ear. But these are bones that aid in carrying vibrations from the tympanic membrane across our middle ear. And you see them in here as number 1, number 2, and then number 3. 1, 2, 3. The bones of the middle ear. They're called ossicles. The auditory ossicles. There are 6 of them total, 3 in each ear. Their names are the malleus, incus, and stapes, but I'm not going to get into that because we'll do a whole little section on that when we do the ear. Those bones are essential for you to be able to hear. So obviously we're going to talk about those and name them when we do the ears. But that brings to 206. The rest of the skeleton is 200 bones. Add in the 3 in each ear, and that's the 206. The bones in the middle ear. All right. Yay. So Mr. Mahone is finished teaching. Y'all have any questions about the skeletal system? Okay, so what I'm going to do is I'm going to go ahead and activate the quizzes for the skeletal system. And that gives y'all, if no other time, gives you at least till 1 o'clock or, class time to work on that homework, get the quizzes done that need to be done, and so on. I'm going to leave the meeting open the entire time because if somebody else comes in, they'll see that we are actually doing, I'm going to do this, new slide, and I'm going to put on here, let's do it right here. Take this one out. Really, come on.
Do we have to go get our books today, Mr. Mahone, or do we have?
It'd be a good idea, but you don't have to. The building is open Thursday and Friday as well.
Okay.
But remember, the building closes at 4:30. So,
yes.
Just get over here this week.
Mr. Mahone.
Yes.
What books? I have a book already. Do I got to return that one and get a new one?
No. You're going to be with me next module.
Okay.
So it's the people that are moving on after this class.
Oh, okay. Yeah.
You'll still be with me, and it'll be the same book.
Yes, sir. Thank you.
I took 2 quizzes last night. Did you see those, Mr. Mahone?
I'll get them today, but that good, yeah. Like I said, stay on top of those until end of class, and that's so that anybody who joins us a little bit later today, if that happens, will know exactly what we're actually doing. All right, and I'll leave that up, and I'll leave the meeting open until 1 o'clock. All right, so any questions before well, let me do this while, go back to quizzes and activate the skeletal quizzes. I sent out the review yesterday, and this will be activated. I know I said tomorrow morning. Please try to get it done by tomorrow morning at 8 o'clock. They want everybody to turn in their grades before or by around 1 or 2 o'clock tomorrow. So I'll have to get all those grades calculated before I'm able to leave tomorrow. So get that done as early as possible. You'll see it be activated till 10:30. I'll just leave it at that. And get the link.
So everything's due tomorrow, right, sir?
Yes, everything's due tomorrow.
Okay.
Do we have class on Friday or no?
No. Tomorrow's the last day of class. 7-6. I know, you poor thing.
We'll miss you.
I know, yeah. I won't even remember.
Love you.
Y'all didn't hear me, did you?
What?
No, I did.
I heard you.
If you see me in the hallway say, "Hey, Mr. Mahone, it's Christy Ruiz." Okay, I remember you. Be like, what is that child name? The skeletal test due no later
Too many
than
students.
Thursday before end. All right. I spelled Thursday wrong. Okay, that's okay. Y'all get the idea. So that is sent. I see I do have some assignments in there. I'll get that squared away. I'll go back into quizzes and get those grades in as well. But if there are no questions, start sending me your presentations. If I have them already, I think I have like 8 or 9 of them already. If you're sending a PowerPoint, I will be able to run the PowerPoint from here while you talk. So in other words, I'll pull it up just like I do mine. You read it out, okay, Ms. Mahone, change the slide, I'll change it, and get the PowerPoint going. Remember, we may not be able to do everybody tomorrow because there will be like 23 or 24 people. But we'll try to get as many of them done as, as we feel comfortable with. It's not about the presentation, it's about the research. Get me the research. That's what I want to be able to see, that you can actually get online and find some of this information. And in y'all's generation, there shouldn't be any problem with that, being able to find this stuff out there in the world and educate yourself. We call that thing a smartphone for a reason. Use it. It's smarter than you are.
For real.
And you see me do stuff like that. Like, remember yesterday, Tic Delarose? How does that spell? Hold on, let me look that shit up. And that's where you need to be out there on your practice, guys. There will be those words that just will not click with you. For me, it was meninges. For a long, I kept trying to stick in an extra I or E in there somewhere. So I know that about me. So anytime I had to write meninges in a person's medical record, guess what I did? Look it up. And if I ever get in a position where I have to write Tic Delarose in somebody's medical record, I'm looking that mess up before I go writing it in there, spelling it wrong and making myself look dumb. So again, it's all about being able to get out there and find this information for yourself as well. You don't want to be that person in class who, or on the extern site, that has a question about everything. We expect you to have questions. But if you're asking questions about everything, then eventually somebody's going to stop and think, damn, did you go to school? And if you did you learn anything while you were there? So we expect questions, but you also have to be self-reliant and self-sufficient out there. In other words, being able to, excuse me, can I go I'm going to run to the bathroom real quick. Run your ass in the bathroom, look that shit up. Oh, that's what that is. Write it down. And then when you get home that evening, look it up. That's what this research was all about. So
I liked it though, because I saw like a lot of words that we studied and stuff like that. So.
Yeah. So it's not necessarily about the presenting, but I want everybody to have the opportunity to present. But we probably won't get to everybody tomorrow. So don't be that one sitting at home with your camera off going, I hope it don't get to me. Because remember what we do. We speak for a living. What we do is talk to people. You're going to have to get past that eventually. All right, so that is it for today. Are there any questions before I stop talking?
Yes.
Turn the meeting off. What, Wendy? Damn.
Sir, is that name the endocrine glands? Is that like a test in itself? Do I have to write that down?
No, that is part of the classroom test. Yeah, you had to list all the endocrine glands.
Oh,
but on quizzes, it's just not possible to do it that way.
Right.
So
the whole test was in the quiz itself with the code. Okay, I already took that. Okay. That's it.
In the classroom, yeah, you would. And in the classroom, guess what I would give you for the skeletal system?
The whole
damn skeleton.
Right.
And have you go through and name all of those 206 bones. So, yeah, we do lose out a little bit, but we try to make it as much as possible the same, or as close to being the same as possible. But I just couldn't figure out a way to list all the endocrine glands.
Okay.
So, anything else?
Yes, sir. One last thing, Mr. Mahone, from me. I think I'm caught up on all quizzes.
Okay.
Okay. Can you hear me? I'm not for sure, but whatever I don't have, could you email me, please? I'm not talking about the whole everybody. I need to know what I don't have, so I can do it. Because I have a situation, but I don't really come with all that every day.
All right.
My problems,
Right. Number one, you got a lot of homework.
Uh-huh.
And you're right. I think you do have all the quizzes.
Okay.
It's going to be the homework.
Yes, sir. I'm starting on it right now.
So I'll do that in just a minute. What? Who? What?
I said I'm missing just the two tests, right? And I think activated still.
Test and homework.
Homework am I missing?
Yeah, homework for you, Chris. For Isaac, there's some homework I need, and Lionadra and a couple of others. I did send out that homework or the assignment sheet this morning, so check that and see what homework you're actually missing, and get those pages to me, guys. Even if you have to talk to a classmate and say, hey, can you give me the answer to this or whatever. Right now, it's about getting it done and getting it turned in. Okay? You will have plenty of chances to learn it later. Right now, get it done and get it into me so I can get you credit for it. Right.
Sir, if I have any more quizzes that besides the skeletal one, can you email me? Because I think I got them all done last night.
Did.
I think I caught up on them.
You did
okay.
last night. I got that. And you're
Mr. Mahone.
You need to concentrate on the skeletal and then the homeworks. Yes, Chris.
Yes, sir.
I sent you chapter 8, 9, and 14.
Okay, cool. I'll get that in there.
I just gotta send you a presentation.
Okay, awesome.
All right. Thank you. And I gotta do a test. All right, thank you.
All right. Can I like
Did you get? Oh, I was just gonna say, did you get my presentation?
Yes, I did, Maricela. Thank you.
Okay, thank you.
Not going nowhere.
I know, man. I got to pee, and y'all just keep like, well, I got a question. Well, I got a question.
Well, you can stay any more questions.
Okay. Anybody else?
No,
Seriously.
you can.
No, go to the bathroom, Mr. M. Go
Right.
to the bathroom.
I'm just joking. Any other questions before I step away from the camera?
Sir, I'm just confused. You said that because I did the last module with you, right? So I'm not going to be with you. So I have to turn in the book by Friday? Okay.
Yep. And come on. It's not, what's more important is picking up the book for the next module.
Okay.
Yeah, bring that book in, turn it in. They'll give you the one that you'll be using next week.
Okay. Now you can go enjoy your day. Bye.
So
Thank you.
All right.
Yeah.
Thank you.
Bye, sir.
All right.
Have a good day.
I'm going to leave the meeting open, and I'll be in the room. So if somebody just sounds out, I'll be able to hear you if you have any questions.
Bye. Thank you.
Bye, sir.
All right. See y'all in the morning.
Yes, sir.
Mr. Mahone, I sent you my presentation last night.
Did you? Did I get it?
I don't know. You don't have me marked.
I don't.
Nope,
All
you
right.
don't have me.
All right. I'll check on it right now.
Okay, thank you.
All right. Michelle, go ahead and send it again because I'm not seeing it. Did you hear me?
Yes, sir.
Okay. Yeah. Go ahead and send it again because I'm not seeing it, and it might have got misplaced somehow.
Yes, sir. Okay.
Did you see my homework, Mr. Mahone?
Da da da. I'm 76 class folder.
I labeled it homework.
All right, just a second.
Yes, sir.
Chris, I'm not seeing your homework. There's Jose. Chris, I'm not seeing your homework either.
Okay.
Did you say Chris or Carissa?
Chris.
Oh, okay.
Yeah, Chris Cisneros. So send it again, Chris.
Yes, sir, I will.
It's not in junk, no. Yeah, so send it again, please.
Yes, sir.
All right.
Mr. Mahone, you probably haven't gotten the chance, but I know on the it just hasn't have me marked off for that I sent in my presentation.
Maricela?
Yes.
It didn't have you marked off for a presentation. Let me see. There you are. I have yours.
Okay.
Yeah, I got it. It's just I just didn't mark it, so I'll get
Right.
that. I'll
Okay,
get that.
thank you.
It's right there.
Thank you. Mr. Mahone. I guess. Oh, I forgot. I think it was Chrissy who did the skeletal. She said she got one of them wrong because I guess it's not it on the test it was carpals, not phalanges, like on the review or something.
Mr. Mahone, did you get my homework?
Yes, Chris, I got it.
Thank you. I'm gonna send you my presentation right now. I'm just cleaning it up.
Okay.
And I'm sorry, it was Sarah who said that, who took it.
Thank you.
Yeah, Mr. Mahoney, it was Sarah, and she was saying that on the reviews, it says bones of the fingers and toes.
Okay.
Is phalanges on the notes, but on the test, it's actually carpals.
Okay. Phalanges.
I'm sorry?
Just
Phalanges is the correct answer?
yes, phalanges is the correct answer, yes.
But it's counted, yeah.
I'll make adjustment for that.
Okay, before I take it, so is it going to be adjusted or should I just put carpals?
Just go ahead and take it, answer it correctly. If you get it wrong, I will change, adjust the grades. I don't want to get into changing.
Okay,
and reissue.
perfect. Thank you.
Uh-huh.
Thank you.